with the recording. We'll get a countdown in 5. Good morning and welcome to the COVID-19 Emergency Response LDI Huddle Call for September 3rd, 2021. We're going to start off this morning with a great story of all of your hard work from Dr. DeLisi.
Thanks, Dr. McLean. I know Risa's been telling great stories here almost daily, and I got a call last night, and goodness, as I thought about this call overnight, I feel like this is a story I'm going to remember probably forever, and wanted to start today by sharing it with all of you. So Dr. Megan Baker gave me a call yesterday, and she was acquainted with a family that has a 24-year-old son who is an active serviceman for our country. And unfortunately, he has ulcerative colitis, and he was having a flare of that and went into one of the military hospitals in Florida. Now, I think the military hospital in Florida did their best to take care of him, but they didn't have all the resources to take care of someone that was as sick as he was. And so they tried to get this 24-year-old transferred to a higher level military hospital in Florida. And because of the COVID surge there and because of censuses, no hospital was able to take him. So at that point, they tried Georgia, and no hospital was available in Georgia. So I think the family was using Dr. Baker to help them advocate for their son because he was getting more sick. His mental status was deteriorating. I think he was sort of somnolent. And the military said, well, we could transfer him to a non-military hospital, but it has to be an academic medical center. So they called all the academic medical centers in Florida, and they got the same answer. We can't take him. We're too full. We're not able to care for him. They called all the academic medical centers in Georgia and got the same answer. So Dr. Baker talked to Dr. Lagares, and Dr. Lagares, and between Dr. Lagares and Dr. Baker, they talked to the military and were able to convince the officials there that Roper St. Francis Healthcare was every bit as good and better than some academic medical centers, and we're able to get permission to transfer that patient here to Roper Hospital. That patient arrived in the wee hours of the morning yesterday, and as soon as Dr. Lagares laid eyes on him, said, gosh, we got to get this patient to surgery right away. The OR team got right to work and took the patient to the operating room. And when Dr. Lagares opened the patient's abdomen, this patient had a perforated bowel and peritonitis. And, you know, just as a translation of what that means, this patient was extraordinarily close to death. And that means all of you saved this patient's life. You saved a 24-year-old. And, you know, when I think about our mission, healing all people with compassion, faith, and excellence, it's, you know, I've said this to a lot of you recently. Our mission is all people, healing all people, not just healing COVID patients or healing unvaccinated COVID patients. And gosh, I know it feels like that sometimes, but I couldn't be more proud to be associated with this organization. And there's so many of you that found a bed when there were no beds, got them upstairs, got them to the OR, and saved this patient's life. I know there's so many stories that are out there that are similar to this, and you're all doing just tremendous work day in and day out to take care of all of the patients that are coming through our doors and trying to heal all people. But I wanted to share this with you. Again, I think this is just a story that I'm going to think about for forever, and it just makes me so proud to be associated with this organization. And I know each of you is living our mission of healing all people with compassion, faith, and excellence. So thank you for all that you are doing. Know that our thoughts and prayers are with all of you as you continue to take care of patients through this surge. And we want to know what we can do to help, and we're doing everything we can to get you more help to get us through this current surge of COVID. So thanks, Dr. McLean, for letting me share that with everyone here this morning.
Thanks, Dr. Lisi. I just think that's a great reminder of the work that's being done here, and it's why we do what we do. So I appreciate that to kick things off. We'll move on to Karen Hostler with the COVID key statistics.
Hey, good morning. That's kind of a hard act to follow, but here we go. So our 14-day positivity is 21.2. 7-day is also 21.2. We've kind of stayed pretty steady this week, seeing an average of 163 patients per day come back positive, and our projected 7-day census is 158. Total inpatient census this morning is 149 patients. 115 of those are in full COVID isolation. 34 of those, the isolation has been removed. At Berkeley Hospital, we have 17 patients, 16 in full isolation, 1 the isolation has been removed, 6 patients in ICU, 3 patients on a ventilator, and 6 patients holding in the ER. Mount Pleasant has 41 patients, 36 that are in full isolation, 5 that the isolation has been removed, 7 in ICU, 5 on ventilators, and I don't see any holding in the ER at Mount Pleasant. Roper Hospital has 52 patients, 35 in full COVID isolation, 17 the isolation has been removed, 15 in ICU, and 9 on ventilators with 4 ER holds. St. Francis has 39 patients, 28 in full isolation, 11 the isolation has been removed, 9 in ICU, 7 on ventilators, and I see 1 ER hold. Still remaining about the same with vaccination versus unvaccinated. 87% of our inpatient population is not vaccinated. 81% of our ICU is not vaccinated, and 79 of those patients with COVID on ventilators are not vaccinated. Home care has a total of 53 patients, 49 in home health, 2 in home hospice, 1 in the hospice cottage, with 42 pending admissions. Thank you all.
Thanks, Karen. Moving on to teammate health statistics with Sarah.
Good morning, everyone. It's Sarah with Exposure Advisor. We have 112 teammates out today. 31 of those are RN job titles. 49 of the 112 are unvaccinated. We are following 64 positive teammates. 37 of those are unvaccinated. We have 48 teammates in the testing process, and 12 of those are unvaccinated. We processed 28 forms yesterday, 21 new teammates to our sick and testing processes, and we are returning 9 teammates to work today, including 2 RN titles. I just wanted to let everyone know quickly that our screening form appears not to be working from the outside this morning. So if you have any teammates with symptoms, if they could please send an email to rsshteammatehealthcovid@rsfh.com with their employee number, name, date of birth, phone, email address, and symptoms. We'll get them processed as soon as we possibly can. Thank you so much. That's all I have.
Thanks, Sarah. Now, an update from Melanie Stith on the vaccine mandate and exemptions update.
Thanks so much. So the policy is now live, as is the exemption portal for those who are submitting exemptions by September 17th. We are publishing an FAQ today to answer some key questions that some have had and have come in over the last couple of days. So hopefully that will be helpful. And just a reminder for those who are unvaccinated to please get your vaccination. By November 1st, we're standing up some first dose clinics that I think you'll hear more about later. Thank you.
All right, thanks, Melanie. Moving on to teammate availability with Matt Desmond.
And one of the things we heard yesterday in the last couple of days of rounding is around communication around the clearance of our teammates and the hours of operation as we go into the weekend and the holiday weekend. So as part of the report out today with DEET, we'll make sure that is communicated out to all our teammates through Careline, and all the necessary phone numbers, et cetera, are available. Thanks.
Thanks, Matt. Acute care operations, Dr. Segan.
Good morning. I've got a few brief updates this morning. First of all, we're going to be pushing out today updated guidance for Roper St. Francis physicians regarding the management of anticoagulation for COVID-19 infected patients. And I just want to thank the pharmacy, the quality department, and all the physicians that participated in updating that guidance for us. Second of all, regarding 6 South at Roper Hospital, we do have 9 rooms that are going to be immediately available today for negative pressure, and we'll work with Kevin Hoke and the Roper nursing team to move patients into those rooms if needed today, also recognizing that we'll have to work with nursing on staffing those rooms. But those rooms will allow us to increase our capacity to provide high-flow nasal cannula on the Roper campus. Third thing is that we received permission yesterday to go ahead and open up. There are some rooms that have been closed since the new Northwoods ED location opened up. Those are rooms 1 to 4. We are going to head and open those rooms. We will not use those as full ER rooms, as they have not been fully inspected by DHEC, but we can use those rooms to get patients out of the hallways, get them swabbed, and just really help with throughput. Last, we are looking at standing up a swabbing clinic on the Berkeley campus, and would hopefully have more information to come at the next huddle call. Other than that, the last thing I'm just going to ask all the managers and directors and leaders on this message who are listening to please, as you're rounding with your teams today, over the weekend and going forward, solicit the teammates for any little suggestions, thoughts, or ideas of things that we can do to help support them in their daily jobs and in their tasks. As we've been doing that, the teammates have come up with some really good suggestions, things admittedly that some of us as leaders had not thought of or were not aware of, and we're willing to deliver in each and every one of them, but those that we can, each one of those is a win for the team and an important way for us to support our team. That's all I have to report today, Chris. Thank you.
Thanks, Dr. Segan. Moving on to nursing with Risa.
Good morning. Happy Friday. Love that incredible story from Dr. DeLisi. So thank you for everyone that played a part in that. It not only illustrates all the incredible work, but really amplifies the extreme challenges that all of you are facing, we're all facing, and solving for. So again, thank you. I wanted to just reframe where we were as far as contract labor specifically around surge capacity, and walk through a little bit of our journey and in places where we know we have to pivot a little bit to kind of meet the crest of this wave. So just as a reminder, we brought on 34 travelers to open up additional beds at Mount Pleasant. Most of those arrived in August, but we have had some of those travelers back out. They cancel contracts for other contracts. Some of them arrived, unfortunately, and had COVID, not a large number. Or we've had some come that subsequently turned around and left for one reason or another. And so we are just now finishing backfilling that initial 34. While we call them Mount Pleasant, or it looks like that on that tagline, that is really just how we walk through our emergency management plan. That structure is great, and it steps us through spaces we need to open. I know you guys hear that all the time. Mount Pleasant happened to be the first space we needed to open, but each of those contract nurses, I just want to assure everyone, is absolutely contracted to go to every hospital within the healthcare system, and they are being moved throughout the various facilities as needed. So I just wanted to reassure you of that. The second group of 34 we brought in was really focused around critical care. Again, that tide changed as we saw more patients going into our ICUs, which wasn't initially expected. Of that 34, we still have 6 outstanding. There are dates that range from next week, the 7th. We have 11 critical care nurses landing, but extend all the way through the 22nd of September. And our frontline has resoundingly said that's too late. We need more help. We need it now. So thank you for sharing that with us. And thank you to the executive team who has given us some bandwidth to bring in some travelers faster. And we will have information on how many are coming, when they're coming, and try to be more transparent with all the teams around that. So we hear you. We're not just listening, we hear you, and we'll be responding to that. On top of that, we have 14 travelers landing to open another space at St. Francis. And then we did get some ED requests, especially out at Berkeley Hospital, but all of our EDs that we needed to fast track just based on the sheer volume that they're seeing. So again, I'll get better numbers and an easier way for us to update you more daily. I also wanted to update you around the labor pool. We have had such tremendous response. Thank you so much. Our needs primarily remain on weekends and off shifts. So if there are team members that can help in those spaces as either runners or task nurses, we would more than welcome you. I would encourage you to read the FAQs and go to Caroline for the information that you need to do that. But thank you again for all of your support. You have really shown us that this is a team sport. So thank you.
Thanks, Risa. Marcella, you got an ED update?
Good morning. We had 666 patients check into our EDs on Wednesday. Yesterday it was 631. We're working very hard to decrease the number of patients that leave without being seen, and that's improving as well. Presently, we're holding 22 patients in our EDs. 11 of those are COVID positive. The largest number is at our Berkeley ED campus, and so we're going to focus on getting that offloaded so they have ED rooms back to see patients.
Great. Thanks, Marcella. Matt Desmond with a pastoral care support update.
Thanks, Chris. Yeah, we recognize the burden that's falling on the teams across the system, especially in the ICU. And one of the things that came up from the teams yesterday was the presence of pastoral care and how we can communicate out to them and have debrief sessions and give the time for our teammates to grieve for a moment as we're making these transitions. So we'll be pushing out some communication today around the hours, how to contact them 24/7 through the holiday weekend, just as another available resource to support all of you. So keep an eye out. Thanks.
Thanks, Matt. Physician Partners Operations, Jim Ballard.
Good morning. Express care volume remains very high. On a positive note, it looks like it is peaking and we have plateaued at a very high rate. We feel pretty optimistic or cautiously optimistic that it may not get any worse. Staffing is a problem for the Express Cares. The Physician Partners leadership team is going to work with all the practices in the physician network to help augment staffing at the Express Cares. Really grateful for the leadership support there. The vaccines going into the primary care practices, we are waiting for DHEC to approve our Section B forms. That has taken a little longer than we anticipated. It is, at this time, we're not going to be vaccinating as of September 7th, but we will certainly keep everybody updated as to when we will be able to do that. That completes my report.
Thanks, Jim. Troy Powell with Continuing Care Operations.
The post-acute teams continue to do great work managing the high volumes. Especially we're seeing that in our home health agency and across the entire home health community for that matter with delayed starts of care. And but the team is managing and prioritizing those cases as best they can, so appreciate that work. Also, for the group to know that we do have the proning teams in place at St. Francis, Roper, and Mount Pleasant hospitals in collaboration between the acute care therapy departments and the OR teams to help support that bedside positioning need. So certainly if there's ever any need there, please reach out to that group. I know they're happy to support. Thank you.
Thanks, Troy. Monoclonal antibody infusion clinic update with Dr. Oliveria.
Good morning. So we have currently 5 chairs at St. Francis infusing monoclonal antibodies and availability up at Monk's Corner. Our volume of referrals for monoclonal antibodies is about 30 to 40 per day. We can't meet the demand based on the volume of referrals with our current situation, but I think we've identified excellent space at Roper that'll afford us 12 beds or 12 chairs to infuse, and that'll increase our capacity to up to 48 patients per day. Ken Hill, Kevin Hoke, and Doug Robertson are essentially a logistical SWAT team, and are gathering all the essential equipment to get that thing opened as quickly as possible. So we'll be able to meet the demand. And we're also improving our referral process, streamlining it to one source of referrals, an easy online form that providers can use to, with an ask on order entry, walk through the process of determining who's a good candidate for monoclonal antibodies. So hopefully get that up really soon. And that's all for me. Thanks.
Thanks, Dr. Oliveira. Doug Bryan with the vaccine clinic update.
Good morning. We're starting first dose clinics next Tuesday in Berkeley, 7 a.m., Wednesday the 8th at St. Francis, Thursday the 9th in Mount Pleasant. Those clinics will operate on the first come, first serve model. No need to make appointments. All leaders who have a teammate showing as unvaccinated and teammate health records should have received an email yesterday. Please help us get that word out to your applicable teammates. Also, we're planning for booster shot clinics beginning the week of September 20th. Should we get federal approval to move forward with that at that time? And please stay tuned to vital signs for staffing links or signups that are likely to come out next week for those clinics. That's it.
All right, thanks, Doug. And just as a reminder to that booster, currently the only thing that's been given emergency use authorization for booster shots, and that is a third dose of vaccine, is for folks with immunocompromised status. So that has not been given the authorization yet for all healthcare workers. We do anticipate that to come soon, and we do anticipate the start date of that September 20th. That's been what's been communicated previously, but nothing to update there yet, other than to say that current EUA only applies to immunocompromised folks. So moving on to logistics update, I'm happy to report that the oxygen concerns that we have been stabilized, much to the work of what you've been doing and the conservation strategies. So we're still keeping a close eye on that, obviously, and working with our supply vendors, but happy to say that's somewhat stabilized. We have no concerns within materials or in pharmacy. We've got all drug inventories are stable, as well as materials, PPE, equipment, et cetera, is all stable. I'm also happy to update that the lab testing is stable as well. I'm happy to report that the larger platform that we'll be going to soon, the 6800, the launch date for that has been able to be moved up due to all the hard work within the lab and IT. And so happy to report that. Hopeful launch date of September 27th for that larger platform, which will give us a little more maneuverability on testing. We're also expanding the opportunity within the BD Max to give us more maneuverability now as well. All of the testing that's going on in the partners' ambulatory sites and the primary care clinics will be going to Precision Genetics for testing, and that has not changed. Moving on to public information with DeEtte.
Morning. So we're going to share the FAQs about the mandatory vaccination policy. We've got some infographics to help all of our teammates, volunteers, students, et cetera, better understand the requirements, as well as information about next week's first dose events. We'll talk today about how we're offering teammate support with childcare as some schools move to virtual instruction. Talk about how we're expanding access to our post-acute COVID programs at all of our hospitals. Please send your suggestions. We'll have a way for folks to do that. Talk about the labor pool, the need for people to task RNs and runners on evenings and weekends. Talk about the details when teammates are cleared of COVID and their ability to report to work. We're continuing to work to secure access to Moderna for our primary care practices. Chaplains are available. We'll have more details on that. And launching virtual access to therapy services. That's it.
Thank you so much, DeEtte. So as we enter into the holiday weekend, I do want to remind everybody Monday is a holiday. We will not be having a recorded command call on Monday. We will have one on Tuesday, September 7th. So just want to get you to pay attention to that date and look for the call coming out on Tuesday. That's a little off sequence for us normally, but we'll have the next recorded call release on September 7th. As we go into the weekend, you know, I want to reflect on what Dr. DeLisi said. You know, that story he gave actually does demonstrate what our actual highest and most valuable asset, highest economy and most valuable asset here in this organization is, and that's our workforce. You know, that story isn't possible without teammates going the extra mile to try to make room and accommodate and then care for in an excellent fashion a patient who is in dire need. And so, you know, I want to reiterate that our most valuable resource is you. And so please, as we go into this holiday weekend, protect yourselves. I know there's a lot of opportunity this weekend to get together and to commune with folks and to share meals and to enjoy football. I'll be doing all of that, but we'll be doing it safely. And so I encourage you to do the same thing. Recognize where there's social risk. You know, the highest risk areas are going to be when you're in close contact with others and especially sharing meals. And so please protect yourselves. If that means going out and getting vaccinated, please do that. If it means wearing a mask in a high risk location, please do that. but at all costs, please protect yourselves as we go into this holiday, because we've seen every single holiday over the course of the last year and a half has posed a lot of risk, and there's been a lot of transmission associated with it. So please protect yourselves. We care for you, and that's always the goal of what we set our policies and our plans towards, is protecting our community and protecting you. So please do that over this weekend. Thanks a lot.